Good afternoon, everyone. My name is Carol Matricia, and I'm here from Installation Management Command Headquarters at Joint Base San Antonio. I'm the Army OneSource Outreach Program Specialist. I know the slide says Ms. Shania Murrell. She is the Chief of Outreach and Strategic Integration and my supervisor. She's actually here in the room. So she has delegated the briefing to me. So thank you for allowing us to come in and speak with you and talk to you about what Army OneSource does. So just go to slide 4 if you don't mind, please. Next one. Okay. So that is our mission of Army OneSource. So how many of you have actually heard of Army OneSource or actually worked with Army OneSource in any capacity? Great. I'm sorry?
Until they stole our representative from the Northeast.
Well, okay. Oh, okay. All right, so you can read our mission statement, so I'm not going to read that for you, but you may ask, so why did Army OneSource come into being? So if you're familiar with the Army Family Action Plan at all, issue number 562 at the headquarters DA level AFAP was submitted saying that it seemed a little disjointed, the different components within the Army, the National Guard Reserve, and the active duty, and how family programs and services were being provided. So Army OneSource was the answer or response to that issue that was submitted. So Army OneSource was launched, actually unveiled in 2008. And then the technology side, if you go back one slide, they show that we have 3 ways to access family service programs. And again, our main mandate is the active duty side, but it is a multi-component. So you see it is actually addressed. We have the active duty mainly at bases, installations, and garrisons. And so they have a brick and mortars Army Community Service Center that they can receive those services. But we also have the AOS technology or the web portal, and then the AOS Community Partners, which is what the AOS Community Support Coordinators do, similar to what your mission is with joining community forces as well. So go back to the next slide. We have a DOTI, the 1342-22, that mandates that there's a multi-component, multi-pronged process of accessing family programs and services in a standardized manner. And we've focused our efforts into those main 4 areas, which is behavioral health, finance, legal, and faith-based, because those are the areas of largest need for our service members and their families. So we're very strategic about that, and we focus more on identifying those key state stakeholders that could actually influence decisions and actions at the state level, and then where you guys are going to be working in those local communities, and that's where we can really be of benefit to you, meeting somewhere in the middle. So you guys are working community to community. We're working at the state level with our state community support coordinators. And that's where we can really build a very, very cohesive and strategic relationship. And I think that's what's really key. So it's not a redundancy, it's not a duplication, but again, it's a strategic way of really providing those services all across all of the states to the service members, soldiers, and their families that are in all of our communities. We do that through a multiple different avenues, and I think I'm going to turn it over to Kent at this point. I don't know how we're going to do this very gracefully, unmiking me at this point, on how we actually connect those resources through those multiple access points.
This is in the spirit of delegation, this is as low as it goes. I am the bottom of the barrel. And I have to wear this? Yeah. Okay, excellent. While they're putting this on, if you remember General Denton, would you raise your hand? He's on this one. Just raise your hand high and keep it up. If you remember General Denton. Good. Just keep your hand up if you remember. And if you remember his presentation this morning, keep your hand up. If you remember the Venn diagram in the presentation, keep your hand, all right, and you're picturing the Venn diagram, what's in the right-hand circle when you're looking at it? NGOs. Non-governmental organizations. What's in the left-hand? Government organizations. And who's in the middle?
Community liaison.
All right, and like if you had to point at somebody who's in the middle, who is it? It's all of you and all of us. The Venn diagram looks really simple, doesn't it? How does it feel to you being in the middle? Unbelievable, did somebody say? Well, it's pretty complicated. Those governmental systems, well, you can just list them. Each one of those is an unbelievably complicated thing, and they don't all work together. And on the public sector, local side, and nonprofit side, and non-governmental side, they too are their own laundry list of individual systems that are extraordinarily complex. And you've got a bunch of service members and veterans and family members in the middle whose personal lives are extraordinarily complex, trying to figure out how to pull all that together. It's an unbelievably complex, overwhelming set of tasks. And my job, given all of that in the next 4 minutes, is to try and lay out 3 things that I think Army OneSource brings to the table that you can use, you can leverage, can be of benefit to you in that middle. We're one more organization, Army OneSource is, in that alphabet soup of people who are trying to figure out how to leverage those non-governmental organizations. I guess the other thing I'd say is to pick up on Stephanie's last comment that she made on the way out about don't go asking for money, ask for help in solving some problems. Here are 3 things I think that can help you tell that story. What's on the screen now is a slide that shows some of the people, some of the types of people that Army OneSource currently has relationships with in most states that can help you. And this is all on the website and that we'll give you, and you'll have access. They're going to get you this slide presentation and all that, so you don't worry about writing anybody down. But we've been working very hard in professional communities in virtually every state to create heightened awareness, training, and competency, increased competency in behavioral health systems. So if you think where any local provider reports up to get certification, through their state association, through their state health department, through their state mental health agency. We've worked and developed relationships with leadership in those state public sector organizations and professional associations that fall in that non-governmental circle. And so those folks are aware of service member, veteran problems. We have now provided over 32,000 hours of online training to behavioral health professionals for their professional certification and licensure issues. We also do similar work in the legal arena with attorneys and bar associations. So there's an online set of courses that those folks take. The resource for you in going to Stephanie's colleagues around help and support and resources is you've got a handful of professional folks who ultimately need to provide much of the treatment capacity you need that can go hand in hand with you to the foundation community and help frame the issue from a professional discipline perspective as well. So one thing Army Resource brings is an existing set of civilian sector professionals that can be part of your work, part of telling your story, part of knitting together a strategic approach that you can walk in the door of any of those foundation folks and say, this isn't just my Guard family program, this is a larger strategy, and other players are involved and invested in it. So that's one thing. The second thing, Carol, let's go to slide 12. And Yvonne, if we can get a couple of those to each table. The other thing that matters, I think, in the experience I've had, especially in the foundation community, but also if you're trying to cause folks in non-governmental and civilian governmental agencies to spend their money differently, to address the population you care about or we all care about, real data matters. And there are some sample maps that are coming around that are available at the AOSresourcecenter.com about every state. We've tried, and let me tell you who the audience for these maps originally was, and that'll give you some ideas about how best to use them. We tried to think crisply about if I was a state director of the Department of Public Health or Department of Social Services, or if I ran the state association that provided professional credentialing for psychologists or psychiatrists or anybody in the behavioral health arena, what's the data that would help them say, look, we're going to end up seeing service members, veterans, and families sometime in this process. We ought to get in the game proactively. So we pulled deployment and reintegration data from 9/11. We applied some of the best thinking and research we could about what that means for rates of PTSD, TBI, unemployment, homelessness, suicide ideation, and created a set of maps for every state that can help lead the discussion with the professional community and that non-governmental sector about problem solving. The byproduct of that in a couple of states, when you heard the general this morning talk about AlaVetNet, if you look at the governor's briefing packet that he uses with the legislature, these maps for Alabama are the heart of their story. In Georgia, and there's a set of maps, a couple of maps in there from Georgia, in the last 60 days, they've just received a $150,000 commitment to help with the recruiting and training of veteran mentors for their veteran court system. So the data and the maps became part of the compelling story to move forward, and those are all available at the AOSresourcecenter.com for people like you who are in the middle of trying to figure out how to pull those systems together as a way to have the more honest, direct, tangible conversation about where to work. And I guess the last piece I'd look at, and our time's about up that quickly, also at that website, the Army OneSource Resource Center, there's a set of education and training materials that can help move your conversation farther. There are, in the can, 13 very high-level web events that were done last year. They're all recorded. All the materials are online. There were 63 top-tier, nationally renowned experts that participated in those. For example, if you've got a community group that's worried about consumer protection and the financial interest of service members and veterans, there's a session in there with Holly Petraeus and what they're doing at the Consumer Finance Protection Bureau. If you're interested in how to really do better outreach to this generation and where they connect, there's a session in there from Lee Rainey, who runs the Pew Charitable Trust, major research effort around that issue. So it's the best people in the country on a set of 13 issues from last year, and there'll be another set this year. There also are all of the training courses for behavioral health professionals, first responders, lawyers on military cultural competence and PTSD that are available to those professions free of charge through you if you want to use them as the entree to be able to create the relationship. So those are tools and resources available to you through the Army OneSource Resource Center. I'm going to put a period in it there. We'll have time for questions at the end, but I want to turn this to Army Community Covenant and Maria Lloyd. They also have some tools that are part of the kit that can help those of us in the middle trying to pull these circles together.